Hello, it's Dr. Rhonda Johnson, and today is Saturday, August 7th, 2021. And today I'm going to be talking about rapid COVID testing in schools. Well, folks, whether we're ready or whether we're not ready, we're all being ushered into the Delta era pandemic now. It's a whole new pandemic with required changes in the way we live our daily lives. So we know that Delta is impacting the unvaccinated. Most of the Delta variant infections are occurring amongst the unvaccinated, and children under 12 here in the United States are one of the big demographics amongst the unvaccinated. And now they're going back to school. Some schools have already started their in-person learning. Other schools will be opening their doors soon. And many parents are wondering, is it safe to send my child back to school? Can schools safely reopen given the rise in the Delta variant? So I want to spend some time talking about rapid COVID testing in schools. I read 2 scholarly medical articles this week, and both articles recommended rapid COVID antigen testing in schools as one of the best strategies we have for keeping our schools open and safe. Now, the CDC recommended COVID screening testing in K through 12 schools as part of their July 9th updated guidance for K through 12 schools. So rapid COVID testing, folks, this isn't new. I want to just start by saying this is not new. This is what the collegiate and professional sports teams have been doing for the past year. The Tokyo Summer Olympics tested the Olympic athletes and team staff daily. So if it works there, I know it can work in the schools. And it's time to try. Why test in schools, folks? Well, we know that COVID is just too dangerous. Kids may not get sick, but some kids may get sick enough to end up in the hospital. This is our first year dealing with this Delta variant. And we do have different tools than we had last year. We can rapidly test our way out of this pandemic and see if we can keep our schools open. Here's what the science says about rapid COVID antigen tests, that they don't now generate too many false negatives. Some of those early tests have been eliminated. And so what it means that if you're negative, generally you're not contagious for COVID. And rapid antigen tests reliably indicate whether or not a person is contagious. If you're negative, if you have a negative rapid antigen test, this means that you're not contagious at that time. And that's how we can control school outbreaks. If somebody tests positive on a rapid antigen test, we put them in isolation. If it's a student, we call their parents and have them come pick them up. And then they have to go into isolation or quarantine for 10 days. And same thing for staff. They go home. These rapid tests are cheaper. They can be done anywhere, anytime. They don't require a healthcare professional to administer the test. They are simple to perform, and they work like home pregnancy tests. So if you get positives in a classroom or in a school, you can close the school down rather than waiting days for the PCR tests to come back. So it means, parents, that it's going to be times when schools or classrooms close and reopen. I mean, this is the new way we're going to live. But at least rapid tests give us one tool to have schools open and our kids return back to school. Schools in most states are open for 36 weeks out of a school year. And again, schools in Europe, case example, Switzerland, they kept their schools open last year by doing rapid testing. Here in the United States, the state of Delaware piloted this rapid antigen test program in 5 schools over the summer. Parents had to opt in. The kids had weekly, or in some schools may decide monthly testing. It'll be up to the school to decide or state how often they're going to test. It's a nasal swab. It takes minutes. It's not painful or invasive. Parents do have to opt in probably. And I want to encourage parents that don't consider this as an invasion of your child's privacy. This is just one more tool that schools have to keep the kids safe and keep the kids' schools open. Remember, schools have had to make a lot of changes. They've had to institute massive shooter protocol training. That was a hard pill for many parents to swallow, but instituting rapid shooter protocols at schools have saved some lives. Some schools, particularly high schools, have to have mandatory metal detector screening before the kids can enter schools. You know, that was a hard pill to swallow, but again, we're constantly adapting to these new requirements because of our day-to-day lives are changing. Rapid testing probably is going to be so common in the future that we don't think about it. So my message today is, be prepared for this. It's a good way to screen for contagiousness. You may ask, well, what about temperature screening? Numerous studies have shown that's not reliable. What about checklists? We all get asked these questions when we go to doctors or if we make a plane reservation. Again, anything where people have to voluntarily enter their information, the honor system doesn't always work. Now, I always want to take a minute to remind parents of kids 12 and up to consider getting your children vaccinated. I believe that it's safe. I believe that it's one more tool to help keep your kids safe during this pandemic. That's my message today. As always, my views are my own. I hope that it's been helpful. Please feel free to share this message to a parent of a school child. As always, have a blessed day.